The purpose of this video is to show you the method for simulating a total knee arthroplasty on a three-dimensional bone model of the lower extremity using mechanical alignment with the limb set at a 0-degree hip-knee ankle angle as an example. In this video, you will see how to simulate a distal femoral cut that's perpendicular to the mechanical axis of the femur. You will see how to simulate a posterior femoral cut that's parallel to the transapicondylar axis. And you will see how to simulate a tibial cut that's perpendicular to the mechanical axis of the tibia. First, I will show you how to simulate the distal femoral cut. Here is a bone model of a normal right limb. This model has been aligned in the kinematic coronal plane, kinematic sagittal plane, and kinematic axial plane. This is to ensure the correct projections of the model and to reduce the error in the measurements. To identify the mechanical axis of the femur, we first find the center of the femoral head. This is done by fitting a sphere into the femoral head. The center of the sphere and it identifies the center of the femoral head. Next, we will switch to the axial view of the femur. We will identify the femoral knee center. This is the most anterior point in the middle of the intercondylar notch, shown as the red dot here. Then draw a line connecting the femoral head center and the femoral knee center. This line represents the mechanical axis of the femur. We then create a plane that simulates the distal femoral cut. The orientation of this plane is perpendicular to the mechanical axis of the femur. The level of this plane is adjusted so that the minimum thickness of the distal bone resection is 8 mm on one of the condyles, which matches the thickness of the distal region of the femoral component. In this example, the distal medial femoral condyle has the minimum resection thickness. We then measure the thickness of the bone resection on the contralateral condyle, which is the lateral condyle in this example. Next, I will show you how to simulate the posterior femoral cut using the transapicondylar axis as an example. Now you're looking at the axial projection of the distal femur. The transapicondylar axis is a line connecting the most prominent points on the medial and lateral epicondyles. To find the most prominent points, create a cylinder and adjust the radius of this cylinder so that it fits into the distal and posterior regions of the femoral condyles. Go to the lateral projection and elongate the cylinder so there's only a small area of bone visible. Draw a point at the center of this area. This point represents the lateral epicondyle. We use the same method to find the medial epicondyle. Then draw a line connecting the medial and lateral epicondyles. This line is the transapicondylar axis. We then create a plane that simulates the posterior femoral cut. The orientation of this plane is parallel to the transapicondylar axis. The level of this plane is adjusted so that the minimum thickness of the posterior bone resection is 8 mm on one of the condyles, which matches the thickness of the posterior region of the femoral component. In this example, the posterior lateral condyle has the minimum resection thickness. We then measure the thickness of the bone resection on the contralateral condyle, which is the medial condyle in this example. Last but not the least, I will show you how to simulate the tibial cut, which is perpendicular to the mechanical axis of the tibia. To draw the mechanical axis of the tibia, we first identify the tibial knee center. View the tibial plateau in the axial projection. Locate the midpoint between the two tibial spines. This point represents the tibial knee center. Then we identify the center of the ankle. At the tibial plafond, draw 4 points locating at the 4 corners of the plafond. Then draw 2 lines connecting the corners of the tibial plafond diagonally as shown. The point where these 2 lines cross is the center of the ankle. Then draw a line connecting the tibial knee center and the ankle center. This line represents the mechanical axis of the tibia. We then create a plane that simulates the tibial cut. The orientation of this plane is perpendicular to the mechanical axis of the tibia. The posterior slope of this plane is adjusted so that it's parallel to the slope of the lateral tibial plateau. The level of this plane is adjusted so that the minimum thickness of the tibial resection is 9 mm on one of the condyles, which matches the thickness of the corresponding region of the tibial component. In this example, the medial tibial condyle has the minimum resection thickness. We then measure the thickness of the bone resection on the contralateral condyle, which is the lateral condyle in this example. The simulation of a total knee arthroplasty is now complete. Thank you for watching this video. To download this video, please use the QR code below.